What if your body has been warning you about diabetes every single day for months, possibly years, and you have been reading those warnings as something completely harmless? Before any blood test arrives on your doctor's desk, before any formal diagnosis is ever made, the signs may already be visible right on your feet. Most people believe diabetes can only be discovered through a laboratory. You schedule the appointment, the blood is drawn, the lab work comes back, and that is when you find out. I understand why people believe this. For years, that is what my own patients told me too. But after more than 2 decades of practicing medicine and examining tens of thousands of patients, what I see confirmed in my office every single week is this: your body starts warning you about elevated blood sugar long before any lab result would. And the very first place your body speaks up is your feet. Just last month, I sat with a 67-year-old retired man who came in for a routine checkup. He appeared healthy. He felt fine. But before we ran any blood work, I asked him about his feet. He told me his feet had been a little numb for a while, and he had figured it was just his age. He had 4 of the 9 signs I am going to show you today. His fasting blood sugar came back at 214. He had been diabetic for more than 2 years without knowing it. The American Diabetes Association estimates that 1 in 5 Americans with diabetes do not know they have it. That is more than 8 million people carrying a condition that is quietly damaging their nerves, their kidneys, their vision, and their feet. A $12 blood test can catch this early, but first, you need to know what to look for. Today, I am going to show you 9 signs that were already on that patient's feet and that may already be on yours. For each one, I will tell you what most people assume it is, what is actually happening inside the body, and one practical daily habit that can help protect you. Sign number 1 is something almost every patient has already experienced, and almost every one of them has explained it away. Tingling, numbness, that pins and needles sensation in the feet. My patients almost always tell me their foot falls asleep sometimes. They were sitting with their legs crossed, they shifted position and it went away, and yes, that happens to everyone occasionally. But I always ask the follow-up question: is this happening regularly without any obvious reason? Because if the answer is yes, we need to talk about what is actually causing it. Frequent, recurring numbness or tingling in the feet, what physicians call peripheral neuropathy, is one of the earliest signals that blood sugar has been elevated for some time. The excess glucose in your bloodstream begins attacking the outer protective coating of your nerve fibers. It is a slow process, which is exactly why most people miss it for so long. I use a specific analogy with my patients. Think of your nerves as electrical wires. Every wire has a plastic insulating coating. That coating is what allows signals to travel cleanly from your brain to your foot. When blood sugar stays elevated, it acts like a slow acid dissolving that coating. The wire continues functioning for a while, but the signals begin getting fuzzy. That fuzziness is the tingling you feel in your feet. The American Diabetes Association has documented that peripheral neuropathy affects nearly 50% of people with diabetes. It is the single most common complication of the disease, and it almost always begins in the feet, which means right now, tens of millions of people are experiencing this tingling and writing it off as nothing. Daily habit for sign 1, a 20 to 30 minute walk every day. Not a run, a walk. Movement is the single most effective tool for keeping blood flowing to the extremities and protecting nerve tissue. And begin reducing added sugar in your diet today, not next month. Sign number 2 hits my patients when they are most vulnerable. It does not arrive during the day when there are distractions. It arrives at night when they are trying to sleep and there is nothing to buffer the experience. A burning sensation in the soles of the feet, particularly at night when lying down, is a classic early sign of diabetic neuropathy. What is happening is specific and physiologically important. The nerves in the feet have been damaged by prolonged elevated glucose, and now they are sending incorrect signals to the brain. Your brain receives a heat signal even though nothing warm is touching your foot. The nerve is misfiring. Think of it like a fire alarm with a damaged sensor. The building is not on fire, but the alarm is sounding because the detection mechanism is broken. Your nervous system is doing exactly the same thing. The burning sensation is not originating from anything external. It is coming from damaged nerve tissue sending distress signals. Research published in Diabetes Care has found that burning foot pain is among the first reported symptoms in patients later diagnosed with type 2 diabetes, frequently presenting 1 to 3 years before any formal diagnosis is made. Daily habit for sign 2. Drink at least 8 glasses of water daily to support kidney function in flushing excess glucose and add more fiber to every meal. Vegetables, legumes, oats. Fiber slows glucose absorption into the bloodstream, which is exactly what those damaged nerves need in the longer term. Sign number 3 is where this stops being uncomfortable and starts becoming genuinely dangerous. This is the sign that sends more patients to emergency rooms than any of the others I am going to describe. They come in and say, "I had a small blister from my shoe 3 weeks ago, and it still has not healed." They assumed it would close on its own the way small wounds always do. Most small wounds do heal independently, but not when blood sugar is consistently elevated. When blood glucose is chronically high, your body progressively loses its ability to heal efficiently. The tiny blood vessels throughout the body, including those supplying the feet, narrow and stiffen. Oxygen, white blood cells, and the proteins that repair tissue simply cannot reach a wound fast enough. The wound sits open, vulnerable, and static for days that turn into weeks. Imagine watering a garden through a hose with a serious kink. The water exists in the hose, but it cannot reach the plants. High blood sugar creates that kink in your circulatory system. The healing materials are present in your blood. They simply cannot reach the location where they are needed. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, more than 100,000 each year. Almost all of them began as a small wound that was not given appropriate attention. Daily habit for sign 3. After your shower or bath each evening, sit down and examine both feet carefully. Look between every toe. Look at your heels and the balls of your feet. Any cut, blister, or area of broken skin should be cleaned with mild soap and water, treated with an antiseptic, and covered. If it has not visibly improved within 48 hours, contact your doctor. Not next week. 48 hours. Sign number 4 is hiding in plain sight and has been visible for quite some time for most patients who have it. They walk past it every day without connecting it to anything significant. When I examine a patient for blood sugar risk, I look for specific patterns of discoloration around the ankles, a darkening, deep redness, or occasionally a bluish tint to the skin in the lower leg and ankle region. Patients tell me they have always had darker skin in that area, or they assume it is sun damage, or they simply have not noticed. When blood circulation is compromised by elevated blood sugar, the lower legs and feet receive insufficient oxygenated blood. The skin changes color as a direct response to oxygen deprivation. In some patients, the skin also becomes noticeably thinner and more fragile in these areas, indicating that tissue is not being adequately nourished at a cellular level. I explain it to patients this way. Think of your blood as a delivery vehicle carrying oxygen and nutrients. Your feet sit at the absolute end of the longest delivery route in your body, the furthest point from your heart. When the roads narrow because of damaged blood vessels, the deliveries begin arriving late or not at all. The skin, starved of fresh oxygen, changes color. It is a distress signal you can observe with your own eyes. Research published in the Journal of the American Academy of Dermatology has found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis, 18 months of visible warning that most people never interpret correctly. Daily habit for sign 4. 5 minutes of ankle circles, toe raises, and calf stretches every morning before you begin your day. Even that brief movement gets blood flowing actively into the feet. If standing exercise is difficult, elevating your feet slightly while seated can make a meaningful difference in circulation. Sign number 5 is the one that surprises my patients most because it looks completely harmless. Most of them have lived with it for years and never once associated it with blood sugar. "Doctor, my heels crack every winter. It is just dry skin." I hear this almost constantly. Seasonal heel cracking from dry air is common and usually manageable. But when the heels crack in summer or when no moisturizer helps regardless of how consistently it is applied, that is a fundamentally different situation. Diabetes affects the autonomic nerves, the ones that control automatic body functions that require no conscious thought. One of those automatic functions is regulating moisture and sweat production in the skin. When these nerves sustain damage, the sweat glands in the feet stop operating correctly. The feet lose their natural moisture from the inside, at the level of nerve-controlled gland function. No topical lotion can address this root cause because the problem is neurological rather than superficial. Think of your skin as a wall that needs to stay sealed. When the autonomic nerves that maintain that seal are damaged, the mortar between the bricks begins crumbling. Cracks form. And those cracks in the skin of the foot are not cosmetic issues. They are open pathways for bacteria and infection. In a foot with poor circulation, a bacterial infection can escalate to serious consequence very rapidly. The American Podiatric Medical Association identifies chronic treatment-resistant heel cracking as a significant indicator of autonomic neuropathy in older adults, a condition directly linked to prolonged elevated blood sugar. Autonomic neuropathy is not a minor inconvenience. It is evidence that the nervous system is under serious, sustained stress. Daily habit for sign 5. Apply moisturizer to the soles and heels of your feet every night before bed. Pure coconut oil or a quality foot cream both work well. Apply thoroughly to the sole and heel area. Never apply moisturizer between the toes. Trapped moisture in that location promotes fungal infection. And continue prioritizing hydration from the inside with at least 8 glasses of water daily. I want to pause here. We have been through 5 signs together, and I want to ask you something directly. Have you recognized any of these in yourself or in someone you care about, a spouse, a parent, a sibling? If the answer is yes, even one sign, go to the comments right now and type the word yes. That is all. I read every single comment. If you have a question, ask it here. That is exactly why I create this content. Sign number 6 is more serious than most people appreciate because it is not only about the feet, it is about what is happening to the kidneys at the same time. Persistent swelling in the feet and ankles, swelling that is present most days, and that leaves visible indentations when you press your finger into the skin, is a sign that deserves medical attention. Most patients attribute it to standing on their feet at work, or to the heat, or to age. Occasional swelling from prolonged activity can be normal, but daily, consistent edema with those characteristic indentations, called pitting edema, is a different matter. Chronically elevated blood sugar damages the kidneys over time. The kidneys are responsible for regulating fluid balance throughout the body. When kidney function is impaired by years of glucose damage, fluid accumulates preferentially in the lowest part of the body, your feet and ankles, where gravity collects it. Think of the kidneys as the filtration plant for your entire circulatory system. Every drop of blood passes through them to be cleaned and balanced. When high blood sugar damages those filters, the system backs up. Excess fluid has nowhere to go except downward. Gravity collects it in the ankles. The National Kidney Foundation has reported that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently among the first visible signs that kidney function is under stress. Daily habit for sign 6. When resting, elevate your feet above the level of your heart, even a few inches on a pillow, to encourage accumulated fluid to drain back toward the body's center. Reduce sodium intake significantly. Salt causes the body to retain water, which worsens edema substantially. Read labels carefully. Canned foods, processed meats, and restaurant meals are major hidden sodium sources. Sign number 7 is the one I see most frequently misattributed to other causes. By the time patients understand what it actually is, they have often been managing it with over-the-counter pain medication for months. Stabbing, sharp, electric shock type pain in the feet, particularly at night, is often attributed to arthritis, an old injury, or general joint deterioration. And sometimes those attributions are accurate, but when the pain is sudden, intense, described as a hot needle or an electric shock, and appears without any physical trigger, it frequently has a different origin. When nerves sustain damage from chronic elevated blood sugar, they do not always go quiet. Sometimes they become hyperactive. Instead of going numb, they begin firing random, intense signals that the brain interprets as severe pain. This happens most often at night when there are no other sensory signals competing for attention. Think of a car alarm that was damaged in a minor fender bender. Every few minutes it activates for no reason. No one is breaking into the car. The alarm mechanism is simply malfunctioning. A damaged nerve does exactly the same thing. It fires pain signals when there is no actual tissue injury. The pain is completely real. The nerve generating it is simply broken. Taking ibuprofen for this type of pain does not address a damaged nerve. It masks a signal your body is actively trying to send you, and masking important signals is counterproductive when your nervous system is asking for attention. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is frequently misidentified as arthritis, tendinitis, or normal age-related joint pain. Daily habit for sign 7, 5 minutes of gentle foot and ankle stretching before getting out of bed each morning. Flex the feet, circle the ankles, gently pull the toes back. Get circulation moving before weight is placed on the feet. A light 3-minute massage along the sole and up the ankle before bed can also provide meaningful neurological stimulus to the area. Sign number 8 tells me how far the process has advanced when I encounter it, and the patient's response is almost always identical. They laugh and say their feet have always been cold. Cold feet that persist, regardless of environmental temperature, cold in summer, cold under heavy blankets, when the rest of the body is warm, cold in a heated room, are a strong indicator of significantly compromised blood circulation in the lower extremities. The blood vessels have narrowed or stiffened to the degree that warm blood is simply not reaching the feet in adequate volume. Think of your circulatory system as a heating system, running pipes to every room in a house. When those pipes narrow from decades of glucose damage, heat does not make it to the far end. The room stays cold no matter how hard the furnace operates. The temperature problem is not about the furnace or the weather. It is about the pipes. The American Heart Association identifies peripheral artery disease caused by narrowed blood vessels as affecting more than 8 million Americans, with diabetes being the single largest contributing risk factor. Persistently cold feet are among its earliest and most consistent symptoms. Daily habit for sign 8, a 30-minute brisk walk every day, not a casual stroll, a purposeful, actively paced walk with arm movement. This forces blood circulation actively into the feet and lower legs, strengthens blood vessel walls, and can over time partially reverse early-stage narrowing. Start with 10 minutes if 30 feels inaccessible. Begin today. Sign number 9 is the one almost nobody talks about. I have never seen it covered in a patient brochure. Most people walk right past it, and many physicians do not examine for it specifically. But once you know it, you will not overlook it. On the lower legs and tops of the feet, sometimes there is a visible absence of hair. The patient looks down and says, "I never noticed that." And that is exactly the problem. It is a quiet, easy-to-miss change, but it carries significant meaning. Hair follicles require a steady supply of oxygenated blood to function. When circulation to the lower extremities is substantially impaired by prolonged elevated blood sugar, the follicles in the feet and lower legs stop receiving what they need. Over time, they stop producing hair entirely. Think of hair follicles as small plants in a garden. When the irrigation system narrows or partially blocks, the plants do not die immediately. They simply stop growing. The absence of growth in this specific location is your body communicating something visible and specific about the condition of your blood vessels. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in patients with elevated blood sugar and is considered a reliable, though frequently overlooked clinical indicator. After watching this, look at your lower legs and the tops of your feet. If the hair is significantly thinner than on the rest of your leg or absent entirely, schedule a blood glucose test this week. A $12 test at any certified laboratory, covered by Medicare for most adults over 65. $12 for information that could change the entire direction of your health. We have covered 9 signs now, 9 ways your body has been trying to communicate something important through the least dramatic available channel, your feet. Here is the single action I am asking you to take tonight. Before you go to bed, sit down and spend 30 seconds looking at your feet. Check the skin. Look between the toes. Notice whether you feel any numbness. Look for any wound that should not be there. 30 seconds. If you see or feel anything from this list, call your doctor tomorrow, not next week. Tomorrow, because the earlier an elevated blood sugar situation is identified, the more completely and the more easily it can be addressed, in most cases through dietary changes, a daily walk, and an ongoing relationship with your physician. You have invested decades in building your health, your independence, and your ability to do what matters to you. Do not allow something as manageable as blood sugar to quietly dismantle that investment simply because nobody explained what the warning signs look like. Now you know what they look like. Go check your feet tonight.